Welcome back right here at World of Wellness. And this is our roundtable discussion. You will find us here 3 days this week, Monday, Wednesday, and Friday at noon, finishing up our day just talking about some real world issues, things from the functional medicine side of life where we normally dwell in, but also what we can do together to make our medical and functional medicine protocols better. So today we're going to be talking about medical treatment in a COVID world. I have some thoughts and things that I want to discuss and share, as I am sure you do.
Have some thoughts? I can only imagine, Joe.
Right, just a few thousand. But just to introduce your panel, with me today is Jamie Dorley, CEO and owner of Nutritional Frontiers and the World of Wellness. He has been in the industry, gosh, you look so young, I can't believe it, 30 some years, but as a product expert out of the realm of personal training, but has worked with thousands of doctors when it comes to functional medicine and integrating nutraceuticals into their practice. And then Joe Messino, aka the godfather of nutrition, also in the industry over 30 years, and from a manufacturing and vendor application, along with protocols, products, and ingredients expert. So there's no two better here. And then my name is Tracy Straub. I'm a naturopathic doctor, but I'm also the vice president of education and marketing at Nutritional Frontiers. And I come out of the clinical aspect of all of this and the application of everything. So, and I also train and educate medical professionals on integration of nutrition as well. So, guys, we've seen it from all sides. And I have to say that I'm not really impressed with the way that the powers that be are treating COVID.
Yeah, it's interesting you say that, because we've been right at the forefront of this from the beginning. We predicted that it was going to be immune issues, right? And then we said emotional wellness, and then we said weight and autoimmune. So everything that we said from the beginning, we put our team together, we brainstormed, Joe, we thought of all the different scenarios, and for the most part, we've been right on, right? My concern is that working with Dr. Jeff Bland and Dr. Weiner for years, they weren't anti-medicine, but they said, anytime you take a medication, you should wait about 7 years. Because if not, they're doing research, but it's on you, right? Mm-hmm. And look at these examples. Bayer, right down the road, had their cholesterol medication. And what happened to that? Yeah. Pulled off the market because one of the side effects is, if you had to rank the side effects, I think the number one answer, the worst one would be death, right? And that was one of them, So you look at Celebrex and Vioxx, been so many examples of these over time that you really need a good amount of time to do research before you do the research on you. So I understand people are very scared these days. The fear is really deep-seated now more than ever. But a couple of things I recommend. One is, make sure you're very cautious of what you're listening to, right? And question everything. If you want to question us, that's fine. But I don't watch news because there's no more news stations. I think the last reporter was probably Walter Cronkite, Joe. Remember him?
But, yeah, where he predicted all this coming.
The opinion is designed to get you scared. So Tracy's got some incredible research from a doctor's level. Joe from a researcher level. But I'll give you one example. So I like football, right? So the first game of the year this year was Dallas Cowboys versus Tampa Bay Buccaneers. And the Dallas Cowboys, their best players, their center, Zach Martin from Notre Dame. Been a big fan of his for years. And Zach couldn't play opening night because he was diagnosed with COVID. However, he was vaccinated. And I love what the announcer said. He says, imagine how sick he would have been if he wasn't vaccinated. Mm-hmm. So you have a football announcer who's a retired player making medical opinions, right? So that's a little concerning for me. So the fact that he was vaccinated, probably because of his job, he thought he had to, but he still got the virus. And I think if you look at it, we're all going to be either get the virus or be exposed to the virus over time. So just remember that, Big Brother, I think, is not always going to be there to help you. A lot of people say, well, I'll get this, or, when I get sick, they'll help me out. They're not going to help you out. So the best thing to do is take the responsibility back onto yourself and make sure you're doing everything you can to make sure your body is healthy as can be. So we see many examples of this. A good business associate of mine, he wasn't at our meeting last week, so he called in for the meeting. And I said, well, how come you're not here today? He says, I'm positive for COVID. I said, didn't you get vaccinated? Yeah, I got vaccinated. He goes, I guess it didn't last long enough, the vaccine, right? And 2 other people at the meeting were there that their spouses were vaccinated and got it. So I'm seeing many examples of this. So the bottom line is you got to build your immune system up to help prepare, not just for this, but for anything that you come in contact with. And, you know, this may be a concern, of course, to everybody, but cardiovascular disease is still the #1 killer in our country. And I don't see him shutting down Mickey D's. You guys?
Well, I want to talk about the 3 levels here real quick. So when I look at COVID in the COVID world, we have a prevention, we have a treatment, and we have a recovery. Those are the 3 phases that I look at. So with the prevention, if we look at the CDC and what they're saying, here's your preventative measures. When we look at treatment and we look at CDC and they say, here's your treatment measures. And then when we look at recovery in the CDC, they say, here are your recovery measures, right? And then if we jump over to the functional medicine world or integrative care, and guys, I'm not including, doctors in with the CDC, because we have functional medicine doctors that know the truth. The CDC is a privately owned company. I think we all need to realize that. They are in it for money. They're a privately owned company. So when we get to the functional medicine side or integrative care, the prevention protocol, right? The treatment protocol and the recovery protocol. So that's the comparison I want to make today. So we're going to start with prevention. What does the CDC say is the avenue of prevention for COVID? And then I want to talk about what does functional medicine say is the avenue for prevention. And then we're going to do the same thing for treatment and the same thing for recovery, because this is big, because I want people to see the difference. And me, I'm visual. I draw out like a chart, like here's prevention, here's recovery, and all the things that were listed from the CDC. And then all the things that we saw actually work with our functional medicine and integrative practices. So I'll let Joe start. What were some of the preventative measures that the CDC put out? Stay in prevention right now. What were the 2 things that they recommend? Or you could say more. What are the things that they recommend?
Stay away from everybody in the world and wear a mask.
Isolation, mask, right? Hand washing. And now we have the all-saving jab of hope, the Fauci ouchie, which I like to call it.
Oh, I like that one. The Fauci ouchie. We need shirts with that one.
I know. I'm Fauci ouchie free. That's how that's what I'm going to say. But so we have the mask, we have the Fauci ouchie, we have hand washing, hand sanitizer, isolation. So let's just take those few. Which ones worked? Has COVID been eradicated through any of those? And has the curve been flattened? And now I'm going to add on isolated child suffocation in certain states from the hours of 7 to 3 during school. That's the next one that's going to help us eradicate this. So which ones have worked? Joe?
Well, none of them have worked, simply because they wouldn't work for any virus or flu season. They haven't worked anywhere in history. They're not going to work for this. And I think that they were all just measures for everybody to wait for the shot. The number 1 prevention, as far as the CDC is concerned, is the shot. Let's not make any mistake about it. These other things were smokescreens and delays just to get to the shot, period. Those didn't work. And now we're finding out that neither does the shot.
Yeah, how long's the shot been out?
They rolled it out at the beginning of the year, January, February, but it's been in mass production since about June, I think.
Okay.
So that's a good summation. We have the mask didn't work, right? So first we needed 3 weeks to flatten the curve, then a mask, then 2 masks. Then we needed masks and social distancing. Then we needed mass social distancing and a vaccine. Now we need all of those plus a booster. And now wait, the least susceptible, least transmissible, we're going to put masks on them in school from 7 to 3, but nowhere else. So that's going to be the thing. So we've seen this like bouncing ball. But Jamie, I want you to talk about functional medicine with prevention. What have you seen? Because you're
you said that because when this thing first happened, right? Everyone's concerned, everyone's fearful. At least I was. All these thoughts go through your head. And I called my dad. He's a real smart guy, but he's a man of few words. And he said after 2 days of like this flatten the curve, the first 2 weeks, he just started laughing. He said, "Would you follow the money like I've taught you?" So I immediately perked right up. I was like, "Oh man, they got me. They sucked me in for 24 hours." I'm thinking, "Hey, in 2 weeks, this will all go away." By day 2, I knew it wasn't, because they already started planting the seed of 3 weeks, 4 weeks, and then I remember Kayla said, "This may go till May," and then here we are a year and a half later. So I think you're right, like the bouncing ball. Like eventually, you realize, aha, wait a minute, I've been misled, right? And I'm not saying the virus isn't there. I'm just saying the measures that they've been telling us haven't worked, right?
Correct.
So I feel everyone's going to get it or be exposed to it. So naturally,
as
what do
they
we
should.
recommend? Yeah, I'm okay with it, right? And my life really hasn't changed. I mean, I started traveling in May of 2020, took the kids right to the beach, and I've traveled at least once a month, some months 2 and 3 times. I've been to 10 different states. So what I've done naturally is, one is I brought my weight down, because I knew that, if I was heavier, that, you're more inflamed and you're more prone to anything. So a lot of people gain weight. I've heard of COVID-15 to COVID-50. I actually went the other way. So I said, number one thing you got to do is get fresh air and get exercise, because that relieves a lot of stress. I'm not going to sit at home and order fast food. So one is the lifestyle program, which we recommend at Nutritional Frontiers and World of Wellness. And then nutraceutical wise, I said, well, let me go back to the basics. And I do the Immunomax, which is your foundation of nutrients, including DMG and arabinogalacticans and mushroom extracts. So that's a formula me and Doc and Joe created, 10 years ago?
Longer.
Right?
Yeah.
So I always tell people, take that every day so it's in your body and you have access. So if you feel any symptoms of anything, you can start taking a therapeutic dose right away.
Sure.
So that's the foundation.
Gotta have it on hand.
Right? You got to have it on hand, folks, because how far can you go into the body? Halfway, then you got to go out, right? So when they say, it's true. Like when people get sick, they say, "Oh, it's going to take a few days to run its course." Yeah, because it's already in your tissue. Now it's got to get out. So use your Immunomax as a foundation. We have chewable, capsule, either one is fine. Then, of course, we looked at what can help prevent the absorption of viruses or bacteria, and that's vitamin D. And there's even studies showing on the PubMed, and Joe talked about this years ago, was how much vitamin D a day do you take? Well, PubMed came out on April 2nd, 2020 and said you need 10,000 a day of vitamin D3 until your levels get up to about 60. And if you have an active virus, including COVID, they say take significantly more for a period of 3 to 4 weeks, right? So this is right on the published research, right? So Immunomax and vitamin D are my foundations. Next thing is vitamin C. I've known since a kid, vitamin C can kill off anything, but you need to take it therapeutically and consistently. So it's Immunomax, D, C, and then we use our Super Zinc, because what we found is zinc will actually inhibit the replication or the duplication or the growth of the virus. So that's my foundation just to start for everybody. Immunomax, CD, and Super Zinc, and incorporate the lifestyle program.
See, that is so, I mean, you just laid it out and people know what to do. They know how much to take. I mean, right now, I think it's the inconsistency, right? Where the CDC is like, well, we're not really sure. We're never sure. 3 weeks, 18 months, plus. Our stance has been the same and studied because there's clinical research on it. The other thing that I try to point out to people is there's no efficacy or safety studies done on masks. So they don't know if they work. That's why they're not FDA approved. They're not an FDA medical device.
Joe's done some studies on the mask.
So, yeah, right, I'm sure. But I'm going to give Joe the treatment panel. Joe, I want you to talk a little bit. Let me go into a few things that were recommended as treatment for COVID. Now, this is active COVID. You have been tested by PCR testing, which we can talk about that in a minute, because the validity of PCR testing, it's been debunked. And by December, we're not even using it anymore because the CDC has said, well, we're not really sure if it's actually picking up COVID and we're just making all this stuff up. But one of the first things that they recommended, and this came out when Fauci said about remdesivir, And the reason that I want to bring up remdesivir was because it was interesting. This was one of the only studies when they studied remdesivir that during the study, they changed the outcome goal. So it was to look at mortality for Ebola. That was what it was first for. And during the study, they noticed that it didn't increase, your chances of survival. It decreased your symptoms, but it didn't increase your chance of survival. Just as many people died on remdesivir as they did not. And the interesting thing, and I have the study, so I'm going to screen share because I want to show you guys this, is that the remdesivir study on Ebola, when they put this out, when they put all of the people on remdesivir, if you guys can see this right here, at 28 days, death occurred in 290 patients overall. Almost half the people that they put on remdesivir died. And they still put it out as a recommendation for COVID. Now, how do we get from doing a study where half of the participants die to making that the new protocol for COVID? I mean, I think that's just, I was blown away. And then they literally went out with an all-out assault on ivermectin, which has been on the market for 60 years with very little side effects, saying that was a horse dewormer. And actually, it wasn't developed as a horse dewormer. It was developed for river blindness for children in third world countries by a man who won the Nobel Peace Prize for developing it. And they crucified him. So we have all this like smoke and mirrors. This is why it's so important for people to do your own research and not rely on the media. As Jamie said, if you follow the money, you're going to look at this. So the other treatment protocols were out there was venting these people. Now adding the remdesivir along with the vent that puts so much interstitial pressure on the lungs that it actually causes long-term lung and kidney damage. Isolation and quarantine. I think we've seen the degradation of health due to that, especially people that have had COVID, have been on a vent, have been in isolation. Now they're experiencing mass PTSD, anxiety and depression like we've never seen before. So this was like the treatment protocols that were put out. And I can't say that there was a traumatic survival rate due to COVID. I mean, we're still in a pandemic. And I said it before, and I'll say it again. I don't hear of all the people dying at home. I hear of them dying in the hospital. So Joe, I'm going to let you run with that. And then give me the treatment protocols that you've seen are functional medicine, licensed medical doctors using in practice that worked.
That was a lot of information, Tracy. And
Sorry.
I think that it really does, didn't surprise me. But, from day one, we've been involved in what we termed a case-demic, as you brought up with the testing. It was all about the number of cases. That's what you heard all over the place. And you're still hearing it. It's about the number of cases, which are not valid. And when, look at the treatment that you outlined. Okay, if you did remdesivir and you had almost half of the people in the study die, and then you did venting on top of it and people died, it almost leads you to believe that that's the expected or projected outcome that they were looking for. Allopathic medicine has never been about the cause. It's never been about the prevention. It's always been about the treatment. Sometimes it saves lives, but many times it's all about the symptom and never the prevention and never the cause. So that's where I think everybody, everyone thought, well, I watch the commercials. I see this drug helps this drug. And if my antidepressant isn't working, add another one to it. And we see all these things. And we've been programmed, as you've said, Tracy, over decades to trust that recommendation. And that recommendation did not work. It is not working and it will not work. Instead of venting, they should have been given oxygen or should have been nebulized with hydrogen peroxide to stimulate nitric oxide production in the body. These are things that are working. These are not part of the allopathic protocol. But the ones that are doing this protocol are getting results, and then they're getting demonized for it.
Well, they're also not allowed to do it, right?
So, I don't want to put anybody on the spot, but let's bring down somebody who's dealt with this. One of our favorite clients, the one and only Dr. Michelle Kunselman. You never know who's going to pop on the screen here. So I'd say to sit on my lap, but there's a lot of people watching. So here, you can sit on my seat. I'm going to, no, get up. You're going to sit down. That's okay. You're a special guest here. I'm
Stay close to her, Jamie. She needs the mic. Yeah.
Hear you.
Well, this is great because Michelle.
Hey,
never know. Michelle is actually
round table.
I got my arm around this. So, Dr. Michelle Kunselman, doctor of naturopathic medicine, close friend of ours, and of course Tracy's. So maybe you want to share your story a little bit, if we don't mind putting you on the spot.
That's all right. But my daughter walks out of the restroom. You just catch her, okay?
Don't let her go outside.
Yeah, last year, about this time, actually, I had COVID pretty severely and ended up on a vent. And the whole mess of what was happening, and honestly still happening in the hospital. I can't tell you how many calls I've had in the last 2 or 3 weeks with clients calling and saying, or friends of clients or acquaintances calling and saying, hey, my friend, my loved one, my mother, my father, my whatever is being put on a vent. What can I do?
I just can't believe they're still doing
we got to start so much earlier. We have to start so much earlier than that vent. We have to start today, in how you're feeling today, and support your system today. But there's a couple of things that are so important if you end up in a pretty severe situation where your body is fighting you hard. There are so many tools that we can use for equipping, and we know more now. We knew some then, we knew the basics, D, C, zinc, but now we know so much more using the SPMs. I'm using them so heavily in my practice. But I left that hospital. I went to the hospital, was vented. I had a 3% chance of survival. So here's a
3%.
little
Wow.
of encouragement
Right here.
for you. If you have a loved one who's gotten in rough shape, there is hope. There's hope because we have a miracle worker in heaven, but there's also hope because there is a lot that we can do to help with your recovery. I left the hospital with a prognosis of needing to carry oxygen the rest of my life.
Where is it?
It's not here with me today. It's just in the air. So just know that there's so much that can be done. There's so many good questions to ask at the hospital. If a loved one ends up there, asking what medications are being given, what their purposes are, making sure they're only put on life-saving medications, not the ones that are just there to make them comfortable, because unfortunately those are the ones that will repress your lung function. And so important to say, are they on something for anxiety? Because the truth is, if they're in the hospital with COVID, they're going to be anxious. And because we are so...
You're in a hospital for everything, anything, you're going to be anxious.
Right, and you're so focused on what's right in front of you. And the doctors are too. So they see the anxiety and they're like, oh, we got to deal with the anxiety. And they give them something for anxiety. And then their lung function starts to get worse. And they're like, oh, no, we've got to do this. And then they keep compounding because they're just treating the urgency and instead of treating the whole person. And so making sure that you're asking the questions, like, what are they on? Why are they on this? Is this necessary for life? Is this necessary for them to be able to breathe and regain their strength and push for, only oxygen as long as you possibly can, and really ask the questions. Why are we venting? Are we venting because you don't know what else to do? Or are we venting because that's
the
your protocol?
They don't have experience either,
right?
They're just trying
It's
to
just
do
the
their
protocol.
best, and they don't know any more than we may know.
Right. And the reality is they're just working on a protocol. So they work on their insurance company's protocol.
Exactly.
You hit this number with your oxygen one time, they're going to vet you. So just know that you have the right to ask questions. Don't get stuck. Don't feel pushed in a corner. Ask for regular meetings. Ask for the one thing that's happening lately that I'm finding is they'll say, well, the patient agreed to whatever it was. And the reality is, how did they agree if they were anywhere near as sick as I was when they went to the hospital? The agreeing could have looked like a nod. And so ask
And
to
they may
be
not
on-
even be coherent enough.
they might not
Right.
be coherent enough.
Right.
So ask to be
They're
on
scared to death. The
FaceTime.
average person doesn't have your experience. They're scared to death.
Scared
Today.
to
They don't
death.
know what to do.
Yeah,
So
ask
they're
them.
going to say, sure. They think they're trying
Right.
to help.
Right.
You know, I think you hit it on the head when you said it's the protocol because, yeah, if your blood pressure gets to a certain number, you're on a drug. Your cholesterol gets to a certain number, you're on a drug.
Right.
You know, this is the protocol. That's how they get paid. That's the insurance, backing on that. And
Yeah.
we know how that works. But before we get
The-
too far into that, I want to know who was the functional holistic practitioner that brought you back?
Well, Tracy and I were. Tracy came on. Dr. Len, who was just on before, played a huge role in helping my husband know how to navigate that situation.
And that was
and
really
know-
difficult because he wasn't allowed in there with you. Like the
Look at your
isolation
skin.
that they
I mean,
had
she
you
looks so
in.
good now.
Oh my
Yeah.
gosh, yeah. Like,
Amazing.
but it was really difficult. And I have to say it took a village. And that's the unfortunate part of this whole
Yeah.
thing is that people don't know what to ask, what to advocate for, what to say. That's big because they just, put their people in there and then they just stand back. And actually we had a friend of all of ours, her husband was actually in with COVID just recently. And she was texting me, what do I do? What do I do? And I kept telling her, I'm like, you have to go in and do these things. And she's like, well, I don't want to make waves. I was like, make waves, make huge tsunamis, because if you don't, then you lose control and he will end up on a vent. And she did. I mean, that hospital did not like her, but she got her husband out of there. And that was the biggest thing. And as soon as he got home, then she could administer the protocols that she knew would work. But they're so rigid to not let you, some of these hospitals, not all of them.
And it's getting worse, not better, as far as the
It
rigidity is what I'm
Yeah.
seeing. Like the hospitals are just getting more and more, at least before they didn't know anything and there weren't a lot of protocols. So they were a little bit more flexible and willing to try things. But now their insurance companies have come down with very rigid protocols. And so they don't have that flex that even they had last year. So get in contact, know someone who prescribes ivermectin, know somebody who prescribes hydrochloroquine, and then, have all these tools that they offer here at Weiner Wellness ready in your home. I have them in my home for, our family's already had COVID, but I just had a phone call this morning from a friend who's pretty sick with COVID. She's like, what do I do? I'm like, all right, I'll be over with some stuff this afternoon. So
Well, here's the study, Michelle, that, is on the SPMs that you were referring to. And this is your big thing. Like when I saw these come on, I'm like, these are going to be the game changer.
Right.
But basically right here, this last sentence, together, these results with SPM and animal disease models are promising and suggest a clinical trial be initiated to test their ability to activate, resolve lung inflammation, reduce tissue damage, COVID-19 patients to stop the cytokine storm, namely adjuvant management of COVID-19 disease or the management of cured humans, the improvement and resolution of chronic lung, heart inflammation, post-acute phase of this disease. We should also consider means to increase endogenous production of SPM in these patients and test their association with outcomes of the disease. This pandemic brings urgent need and suggests that we test whether activation of endogenous pro-resolving mechanisms in COVID-19 patients can expedite their recovery. This was a study done on COVID-19 management and inflammation in SPMs, and you never heard a peep about it. Never heard a word.
Could have been front page news.
It should have been front page
Well, if
and
there was news,
nothing.
you can actually put it on the front page.
Yeah,
you
right.
link on your website
Not
to some of
narratives.
these studies so people can just grab them and print them to show.
Yeah,
That would be
absolutely.
awesome to be able to have that option of just
Yeah, that's the other thing you
Grabbing
mentioned
it.
is the network of people that
Yeah, you
we
gotta
have.
have the
I had a
network.
friend recently, he was really sick. He already had the nutrients at his house, told him to double up,
Right.
triple up. And then we leaned on Joe for his network. We got him to a doctor that does IV treatments.
right.
And then yesterday I was just talking to him. He's like, man, it was dramatic, the
Right.
improvements,
Right.
and he's going to make a full recovery. Wasn't even in the hospital.
Right. And I
Because he leaned on all the different
network.
people.
right.
He says, "Oh, I says you do everything right now. This is
Yeah.
not you're in trauma. You do
Mhm.
whatever it takes to get you healthy, and you
Mhm.
will." And then yesterday, he's like, "I can't believe how good I feel."
That's awesome. And I think a key factor, if you have a loved one in the hospital right now, ask for, almost, I say insist on the doctor to do rounds with FaceTime. They will do it, and they kind of have to. So when they do the rounds, ask for FaceTime
For
on
them to
the iPad
FaceTime the
during
relative
during
right,
their rounds.
right.
Because you need a clear picture of what you're actually seeing, and know your rights as the person that's listed as the point of contact or the person able to make decisions. Know what that looks like. Know what it looks like.
And it holds
There's
them
also
accountable.
a
Right.
window on that now,
You gotta be on
Michelle.
there with him.
There's
What?
also a window on you being able to become the person's right to
That's
make
what I was gonna
decision. It's 3 days, I think. Like if you don't get in there, you don't have any rights.
Right.
So many things are changing, like you said,
Yeah.
and not for the better. And people have
No.
to be so aware.
Right. Yeah.
Big
But
stuff.
there's hope. Even if you end up and get that nutrition checked out right away. Just had somebody call me last week, and her dad is a doctor and ended up in the hospital with COVID, really severe. And she said, "What do I do?" I said, "Get his nutrition levels checked and get an IV with nutrition." At first, you know what they told her? Nutrition is too dangerous right now. Literally, that's
Yeah, it
what
might
they
actually
told
heal
her.
you, right? Yeah.
And I
Oh
was
my
like, "What?"
gosh.
But she pushed because she was a nurse. So she pushed and she said, "No, get his levels checked. I want to see every nutrition
If
level."
you say it again, Joe may combust over.
I
Right.
might-
Just be
so-
careful. It'll get messy if they explode.
Blood pressure's
Right.
going up.
Well, you should. I mean, when I heard that, I was like, "Are you freaking kidding me? We'll try all this crap that nobody knows anything about, but we won't do a nutrition panel." And so I said, "Get it checked. Tell them you'll cover it out of pocket. You don't care what the insurance is," and they did. Got him IV nutrition. Turned around the next day.
Well, it was
Wow.
funny you said
Good
that.
stuff.
One of you guys posted one day. The person asked you guys, "Well, will the nutrients affect the medication?" He says, "Yeah, because one of the side effects is death." So we really hope it does
Right.
interfere.
That's
with
when
the
you say,
medication.
I hope so. I hope it
Yeah,
I
affects
hope
the
so.
medication. Yeah. So the last phase that we're talking about today is recovery. And from the CDC, I looked like, what is the recovery protocol from the CDC? You know what it is, Jamie? Nothing. There's nothing. They're like, good luck, Chuck. I think that's literally what it says on their site. It says, good luck, Chuck. Have a good luck. But we have a recovery protocol, because there are studies on modulating inflammation. There are studies on cellular repair with nutraceuticals. And I know that not only are the SPMs, which we saw in a study here, positioned for treatment, but now I really believe they're one of the things that can help our body overcome all the damage from not just the viral damage, because we do know the virus dysregulates the endocannabinoid system. We know that it dysregulates all different types of things. So recovery for me, I look at Hemp Boost, I look at SPMs, DMG, CircuCore. Like I had a whole protocol that I put together when Robert Scott Bell and I talked about the contagion myth. It still stands. Really, the only thing that I've upgraded it with was SPMs, and I think they're great. And Michelle, I'd like to know, like, what are you using personally right now? Because you're doing so good.
So jumping back I had to jump back on the SPMs. The inflammation tried to, stress will always like peak things in your system. So had removed and my body got a little inflamed again. So jumped back on the SPMs.
Why did you come off of them? I mean, isn't that something this should be something you do. Just ran out.
We naturopaths are really bad at taking care of ourselves.
Really
They're
bad.
like, I've been out of that for 3 months.
Bottle to the person.
Well, that
happens
happens
a
lot. Yeah, that's what I do. Everything I have in I give to my family. Here, take this.
I know.
Yeah.
People show up at my house. I'm like, you need
This
these.
is what you need, because they're at my house talking about the thing.
Yeah.
So but SPMs have been huge, and then just there's a lot that I needed to detox from my system from my hospitalization. And I realized recently that I needed to put more attention to that and not
That
ignore
statement
that.
alone, Michelle, you had to detox from your hospitalization.
Right. Well, I mean, let's just talk about that for a minute.
Yeah.
30 chest x-rays,
Oh,
4 CT scans, and I mean, copious amounts of medication. They gave me so much fentanyl to vent me, because I didn't want to be vented, that they had to give me Narcan. So let's just think about what happened there. My body was strong enough to fight the vent.
Right.
so strong.
Was
enough to,
that your compliance? Was like the no, no, no? Was that how they got you
Right.
to sign the paper? Did they
Yeah.
just like move the paper to get your
Right.
signature as you were
Right.
striking at them?
Yeah, I mean, but if my body was strong enough to fight being vented, did it need the vent?
Right.
Well,
Exactly.
That-
Good
that
point.
that in itself, and I think one of the things we go back
So you're
on is,
invoking logic.
right. Well, don't do that. We can't have any logic
Don't do
here. Stop it. Stop taking
Right.
smart people pills. We can't have that.
Right.
But I think one of the big things for people to realize is that they will not get reimbursed at hospitals from insurance companies if they don't follow the protocol handed down from the insurance company.
Mhm.
So she
Right,
could have went in
exactly.
there and they could have done nothing that was recommended, and her insurance
Mhm.
wouldn't have covered anything. So that's a risk on the hospital if they do that, because they don't know if she's going to pay the cash, and what would that treatment have cost you? Probably $50,000, $70,000, $80,000, right? You would have been bankrupt by the time you're out. So there's probably two sides to it. The hospital wants to get
Right.
paid, but they also want to protect the patient and do what the insurance company is paying for. So unfortunately, our doctors can't be thinkers anymore.
Their hands are
Um,
so tied right
They
now.
are. That's
Even
why
the
when I
really
said,
great ones.
yeah, that's
their
why when I
hands
said
are
when we
behind
were
their
starting
back.
this, right. And when we started this, just so you know, I said I don't even want to talk about the protocol treatments, the protocol prevention, the protocol recovery as a doctor thing or allopathic. Let's talk about it from the CDC, because that's where it comes from. And then
Right.
over here on the functional medicine, where we know there's great doctors and nurses and all kinds of allopathic medical licensed people, they're over there. But we do need our doctors to be thinkers now. We do. We
Right.
need them to step up and say, no, I need to
Right.
be the doctor over this patient. I need to make the best choice. And we need nurses to go with the 8 rights that they've promised, the last being the right to refuse. Everybody has an oath that they take in this community that they all forgot because they're so afraid of not getting paid. And we got to stop following the money. Everybody has to stop following the money. We have to start looking at the person in front of you as a real person and someone that we care about, because that's why we got into this profession. So,
Tracy, they're not going to have to worry about getting paid because they're getting fired. The ones that want to stand up,
that's pretty much
the ones
true,
that
Jim.
don't want to go by the protocol, the ones that don't want to get the shot. They've been caring for people for
So
a
I'm
year
going to
and
give
a
a
half.
little, I have a note on that because I want to go
Okay.
back and tell
Go.
people about where to go. So in Pennsylvania, and this is probably in every state, just so you know, Pennsylvania has the Pennsylvania Human Relations Commission. Okay. This is a commission that investigates and prosecutes all claims of either discrimination within schools or wrongful termination. They will provide you with a fully paid attorney through the whole process. It is a simple go to the website for the Pennsylvania Human Relations Commission. You file a complaint either in the education or in the employment section. You send it back in, and then they go and investigate that claim. Tip to tail, 100% paid for, because they know, and they've always known, that this happens. Now that's in PA. I'm sure there's other, other human
You
relations
put their
commissions
link
in
on the
other
screen
states.
at all,
That'd be
Tracy?
I can't. Yeah, I can do that. But this is for schools
me later.
mandating masks, right? This is for employers. It's terrible what's happening in our country. And the problem is we don't remember our rights and we don't stand on them. We shouldn't have to sue somebody to go to court to have that court tell us, oh, this is guaranteed by the Constitution. You're okay. That shouldn't be happening. What should be happening is there should be an alternate lawsuit that comes against people that are violating our rights. And we are not doing that. And so the only way to start the process, and many people say, well, I don't have the money to hire a lawyer. I can't do it. Well, here's your in. If you're in the state of Pennsylvania, Pennsylvania Human Relations Commissions, tip the tail, paid for 100%. They have to investigate. If there's a case, they will prosecute. If there's a case, they'll give you an attorney and they'll take it all the way as far as it needs. And it goes in front of the, I want to say, the humans, I think it goes in front of the Pennsylvania General Assembly, which is the law writer. But, we have to remember it has to get in front of somebody. It has to get in front of somebody in order to be heard. And you have to take action, because we've been so polite for so long. And so okay, maybe it'll go away. Okay, I'll do what you say. And now, yes, they are taking COVID related cases. And now we're so far away from what is rightfully ours that we don't even remember. And it takes people like Michelle stepping up and being brave and saying, listen, I was mistreated. Although I'm here, it was a lucky I'm here. And not because of anything that you did, but because of the lack of treatment that was given to you. They followed a model from the CDC and didn't follow their oath as a medical provider. That's what they needed to do. That's what they needed to do. And it shouldn't have taken numerous phone calls and numerous advocating by Shane and numerous calls from other practitioners to get you what you needed. Because as soon as that happened, guess what? You turned the corner. Right. As soon as you went, hey, when you were off the vent, can I get off all non-life sustaining drugs? And they were like, oh, that seems like a good idea. Like,
well, they didn't say that seems like a good idea. They actually like, are you sure that's really what you want? And I was like, yes. And they were not, if the nurses especially were not very kind about it. And
that's what I mean. They forget who they are.
Right.
They used to be the person in between you and the doctor. And their oath, the last one they say is the patient's right to refuse. Informed consent, the right medication at the right time for the right patient at the right amount. And the very last one is the patient's right to refuse. And they forget. They forget because they've been bullied. They've been scared. They got all this, unions over them now. And it's just, there's no one left that's going to stand up. And if they do, Joe, what happens to them? They get fired. Right. And that's where we are. And it's sad. And that's where they have to go file a complaint, because I think as of January 1, we're going to go one of two ways. This is all going to just disappear, and there's going to be massive lawsuits. And then you're going to see Edgar Snyder billboards everywhere, or it's going to go the complete opposite direction. But I'm holding hope and faith that, the sovereignty of God and what's going to happens, which I think, he's always in control. But this is
There's been some exposed
wake-up
videos
call
coming out too. Did you see lately there? Yes.
Well, it's a wake-up call for faith. It's a wake-up call for people to, know what your rights are. It's a wake-up call for people to stop bowing down. It's a wake-up call for people to get your health in order. It's just a wake-up call all across the board. And like Michelle, you said all that time ago, COVID was a highlighter, not just for things wrong in your body, but for things that are wrong in the entire world. It has highlighted so much weakness in our bodies, in our system, in our faith, in our society, and it has to stop. It's time. I don't know. SPMs for everybody. Maybe it'll help them be braver. I don't know.
That's right. Yeah.
Be brave with SPMs.
Well, and I just think it's interesting. They're so worried about insurance and being reimbursed. And what's interesting, I found out after I got out of the hospital and had all these crazy medical bills, and we have great insurance. And the reality is I would have paid less on no insurance than I paid on with insurance.
Wow.
So just think about how messed up that whole system is. And invest what God has given you into your health today, because that's where the body has what it needs to fight whatever comes its way. And then trusting also that we talk about this gloom and doom, and I've gone back through that week before I ended up in the hospital. I'm like, what was wrong with me? Why didn't I do the things I knew to do? And you know what? God allowed me to walk through that experience so I could walk with others from a place of understanding and knowing. It was almost like God allowed my brain to just be turned off for that few days when I first started getting sick, because I needed to walk through that so that I could walk through others. So if you do walk through something hard, there is hope. God will keep you and hold you, because he has a purpose for whatever's next, if that's his will for you. But we have to, the doom and gloom of it all can seem a little overwhelming, and that's definitely not what I want to bring to the table. The hospitalization is tough, and we want to avoid that with every ounce of our being. But know that get that network in order, like we talked about, so that you have people you can reach out to. But
got to quote, time to quote RSB, Robert Scott Bell.
Most dangerous
thing in America is a great health insurance plan.
Right.
It is, because they will extort it. So we've gone through the prevention of what works. We've seen that the functional medicine side of things, living a healthier lifestyle, having the right nutrition on hand, at all times. Not giving it away or running out like Michelle and I do is really important. When it comes to treatment, we have seen through not only clinical trials, but research what works. We've talked about SPMs. We've talked about ivermectin, hydroxychloroquine. We've talked about IV therapy as one of them. Isolation doesn't work, guys. Venting, as we see, doesn't always work, and it's very, very low percentage of recovery once you're on there with sustaining damage if you don't know what to do for recovery. And as we can see, Michelle sitting here who has experienced all of it firsthand, that there was no hope given to her as she walked out, except here's a tank of oxygen and good luck to you. Good luck, Chuck. But when she came to the practice that she knows and put in the things that, worked, and then here she is, fully recovered, no oxygen, lungs are getting better. And it may not be as fast as we want, but you know what? It never is. And that's a good lesson for us as healthcare professionals to, empathize with people that, recovery can be a little bit slower, but it is there and there is hope. And there's not gloom and doom because we know what works. The issue is we have to get louder in telling people and not be afraid of doing that. So I would ask anybody here, it's a healthcare professional, to, get a little louder with your people and what matters. And if you are a doctor and you're hamstringed by insurance, you don't have to be. There may be some backlash. There may be some consequences, but is it worth it for that one or two people that you could help? Is it worth it? And my answer is always yes. The persecution, when we count the cost, it's always worth it. So I don't see any questions in the chat. I don't know if they're just all kind of okay, y'all.
We're afraid to ask them a question.
What just happened?
Yeah.
Well, I think people right now, what we're fighting is, the mandates that are coming down, and people are losing their jobs. And these heroes, these doctors and nurses that were heroes just last year, are now the worst villains in the world because they won't get a jab, the Fauci ouchie. They won't get it in order to keep their job. Although they were expected to go into what they thought was the highest hazard situation last year, leave their families, maybe cross-contaminate their families, so on and so forth. And now, after they survived all of that and probably have all the titers they need, now they're going to lose their job because they won't take something that they don't believe in. And, when the majority of a population is refusing it, that's in healthcare. Do you know that the biggest population that refuses the Fauci ouchie? PhD biochemical researchers. They're the number one population that won't take it. The second population is blue collar workers who just don't trust their government. And the third population is African Americans who just don't trust their government. And you know what? They're the three most brilliant. They're the three most brilliant demographics out there, in my opinion, right now. So keep going. Don't be swayed. We have a friend on a vent from a heart attack being blamed on the recent COVID. Is this something Weiner can help with? I send his wife. Yeah, absolutely. Have him stop in. There's a protocol that we have to help the body regain homeostasis. But the biggest thing with that side effect, depending on what it is, and if it's the Pfizer, they're finding that low nitric oxide is the issue. The endothelial tissue is being destroyed. And so you need something that's going to help with viscosity of the blood and healing that endothelial tissue. And we have a product called CircuCore. The ingredients in there have been studied for that exact thing. Not that we're making claims that ours can do that, but we've seen great results, with people that have experienced that. So stop in at the Weiner Wellness Center because there are things that you can do for prevention and recovery and all the way through. Michelle's a walking, living testimony of that. Fauci ouchie, yeah.
Interestingly, one little note as you close, I remember as I was getting out of the hospital, that was right when the vaccines were first being distributed amongst medical professionals. And most of the doctors and nurses had no plans to get the vaccine. And they were the ones in the ICU that were dealing with the huge, population of dying COVID patients.
And they probably all had antibodies.
But they didn't trust it. So just to give you a little, I think that's an important note that you're not hearing the number of medical professionals who are turning it down. You're not hearing, these people that were in the trenches that are like, no, I'm not going there. So even the people who saw the worst of the worst, there were so many that had no plans to get the vaccine.
We're right there with them.
We're not the only ones that were on the inside track, right? And knowing that there were tons of doctors and nurses coming out saying, this is not the right treatment for this, like tons and tons, but they were either their license were revoked or they were just criminalized for going against. And, when we lose the ability to question science, we lose freedom, because science, it is science because you're supposed to question it. That's what it is. Otherwise, it becomes a religion. If you don't question your faith, that's what most religions say in their biblical text. Don't question faith. You just go with it. If we're just supposed to go with it and not question it, this is no longer science. It's a belief. It's a religion. So there's that.
Amen.
Oh, I got Joe to say amen. All right. Well, thank you everybody for joining. Michelle, that was a great surprise. I didn't know you were coming back.
Yeah.
Unannounced, huh? You two
didn't
didn't
know
talk
either,
there?
apparently.
I just
Okay.
was like, I'll just jump in and going down to IKEA. So
Good.
Well, that's great. Thank you. And thanks for sharing your experience and helping so many people through it. God is good and he uses all for his glory.
Absolutely.
All right, guys. Thanks for tuning in today. Thanks, Joe. Thanks, Michelle.
Hey, there's our fan.
This one. No applause. Throw money. Okay. All right, guys. Thanks for tuning in today. We will be back tomorrow bright and early at 8:30 for morning commentary. We really appreciate your attendance. Please share these videos with people so you can help them, so they are aware of the things that are available and what they can do to be healthier. Stop in at the Weiner Wellness, now World of Wellness. That's a lot to say. They are open, deep discounts on all the products. And if you need anything, you can always reach out to me or anybody at the World of Wellness. Thanks for joining. We'll see you tomorrow, and God bless.